Hi, Dr. Mario. How are
Hi,
you?
how are you? Just for those of you who do not know who I am, I I've been a cardiologist, as Dr. Stacy said, for about 40 years. I was an interventional cardiologist, and for the last 5 years, I became a clinical cardiologist. I'm very proud of it. I love what I do, and I live for my patients and the health of my patients. And I was introduced to the Lifewave patches about a little bit over 4 months ago, and it was a life-changing experience for me. And the first thing I thought about was about the health of my patients or what I could do to improve my patients. That was my first thought. I went to med school in Dominican Republic, Spain. I did all my training in New Jersey and Philadelphia. And again, I've been here for 36 years.
Could you share with everyone from your perspective, your point of view, and obviously your research and usage of the technology, what would you recommend or what would you say have you found to be beneficial? Which patch would you start with that you would want to tell everybody about tonight?
I think to be able to come up with a very simple way how to reflect your own energy, infrared lights, electromagnetic energy back into your body at different frequencies that affect different organs and chemicals in your body is something incredible. It's like futuristic.
Mm-hmm.
So, and this is not delivering any medicines to your body, to your system. So that's the number one thing that I want to say is this is just an incredible technology and it does work. I usually start with the X39 patches. And believe it or not, most of my patients that come to a cardiology office, most of their symptoms are musculoskeletal, believe it or not. A lot of them also complain of tiredness, of fatigue, of not being able to breathe well, etc. But we know that the patches, the X39, improves, gives you vitality, energy, activates the stem cells. So the X49 as well. The Aeon patches regulates your autonomic nervous system, where the parasympathetic and the sympathetic system become more in tune with, more balanced with one another, so it can regulate your heart rate and other systems. These patches also lower your fibrinogen levels, also decreasing the viscosity of the blood, the thickness of the blood, and making you less prone to having heart attacks and strokes. That's an impressive quality of the Aeon patch. I think a lot of the benefit of the Aeon patch and even the X39, because the difference between the Aeon and the X39 is just one amino acid in the structure of the peptide of the protein. I'm sorry. The only thing is that the X39 is accompanied by a copper molecule. Mm-hmm. So but they're very similar. So there's some cross effect between the Aeon and the X39 and the X49. So I think they all complement each other very nicely. The fact that they give you energy to exercise, to move, to lose weight, to give you better sleep, it makes you thirsty. Some of these patches do make you thirsty, so it increases your water intake. And this we already know that hydration, oxygenation, activity, keeping your weight down, improving your diet is the key to a good cardiovascular health. I mean, we cannot do anything, no matter what medicine you use or what method you use of treating cardiac patients. If you don't follow rules, you will not be. I cannot be successful, and nobody will be successful. So this is a partnership between providers and patients. I think the patches have become an incredible complement. There's a lot that I need to learn. There's a lot of experience that I need to gain in my practice with my patients. But so far, the experience has been incredible. I have patients who have Parkinson's and neurological disorders. I'm already helping them. The cognitive improvement in patients has been incredible as well. Their activity level, their strength, their optimism, the less pain, the being more up and not depressed. It's just incredible. It's an incredible array of symptoms that basically has to do with what each individual experiences, because we are all different. We cannot expect to have the same response on everybody. But I can tell you that just about 95 or 99% of the patients do have more energy. They sleep better. They feel better. They can exercise. I have a patient with dementia that I saw today who's now riding the bicycle. He looks, I see him just about every couple of months. He looks better now than ever. The patches work. I think it's a wonderful complement to the therapy, and there's a lot more that we are going to find out about the patches in the future as we use them more in cardiology. The carnosine patch is a great patch, not only to increase longevity and improve, lengthen the telomere and hopefully make us younger, but also improves brain function and cardiac function and cardiac performance. So I think that's another complement that we can use with the X39. But I would certainly start with the X39. Like I tell all my patients, let's try 3 months of the X39, and let's see in 3 months what it is that we need to tailor to your particular needs. Is it cognitive problem? Is it more less pain, and is it more endurance? What is it? And then we will go from there. But I would definitely start with the X39.
And I agree, X39 signaling your body to activate GHK-Cu, copper peptide, like you mentioned, elevate that, mobilize our stem cells, your stem cells go to work to repair and regenerate whatever is needed in your body in whatever order. Obviously, we can't pick, which is why I love that we talk about some of these supportive patches. With the X39, we use the Eon, the carnosine, and the X49 as needed per person, right? Individual, of course. I love that you said that. That's what people have to understand. This is an individual basis on what's going on with you. But we use those supportive patches to be able to support those specific systems, the things that you mentioned that the other patches do to help with cardiac function, of course. A lot of people are asking if they're on blood thinners or other heart medications. And obviously we cannot give medical advice. You all know that. And so just as a general, if you're on any medications, what would you say to someone using the X39?
I have given the patches to patients who have had major cardiac surgery, bypass surgery, aortic root replacements, aortic valve replacements. And they're all doing great with the patches. Right now they're regular subscribers to it, and they believe in it. And knock on wood, I have not had any major problem with anybody.
Fantastic. Well, somebody's asking about the Eon patch because you had mentioned fibrinogen. Fibrinogen is one of the inflammatory markers in the body, and we can see a correlation with elevated fibrinogen level, the blood being clumpy and thick, as you mentioned. And of course, with that, would Eon reduce the the thickness of the blood, or maybe even make it too thin? And I want you to answer that, but I also want to share from my personal experience. My daughter had low fibrinogen. She had a blood clotting disorder since she was around 3 years old. And so that was my first question to David Schmidt, because her fibrinogen was almost below 60, which you can bleed out, right, very quickly after that. And so I asked him, my concern was if she had low fibrinogen, which she did. She had a lot of bruises, very simple little bumps would bruise profusely and be there for weeks. And he said, these are his words from David Schmidt. He said, this patch will never bring your fibrinogen level out of balance. It will never take it too low. It will only bring it into balance, because hers was so low. It actually brought her fibrinogen level up into balance to where she no longer bruised. We had an entire year of using X39 Eon, and we used carnosine as well too, but X39 and Eon that brought her blood clotting factors back into balance. So I have to say that from personal experience. Have you had any experience with anyone, or what would you say to that, Dr. Mario?
So remember, fibrinogen levels goes up as an inflammatory reaction to the body. So going back again to the basics, and the basics are be healthy, do what you need to do for yourself. Diabetes, hypertension, obesity, lack of exercise, poor hydration, not sleeping well, lack of oxygen, lack of fresh air, all that can be inflammatory. And I think if we reduce our own personal inflammation, there's no major reason, unless there's a genetic problem, where the fibrinogen levels would be high. We need to correct blood pressure. We need to be tight on the diabetes, improve the diet, lose weight. Come on, we have an obesity problem in this country. We have a food problem in this country, and we need to be health conscious. I practice what I preach. I keep myself on a regular exercise program and eat the right things as much as I can. Am I 100%? No, I like to have fun every once in a while, but I try to keep myself in line for as much as I can. And I think if we do that, we should not have to worry very much about fibrinogen. Yeah, I mean, it's like these patches have turned my life around. I mean, we're starting from lumbar radiculopathy to left hip osteoarthritis to cervical spine disc problems to carpal tunnel to plantar fasciitis, to GERD, and it's all went away. It all went away 90% from day one. A couple of more things that have been stated in some of the testimonials in all the different podcasts is I have been gray, God knows for how long. Believe it or not, my hair is starting to turn black again. I cannot believe it. I mean, I have black hair coming out. It's incredible. I've had a problem with receding hairline. I mean, receding gum line for the longest time, which I think may be traumatic, could be also genetic stuff. My gums are growing back again. I mean, there have been testimonials.
Wow.
So it's like what I tell the patients is, you know something, try the patch. I'm not going to tell you all the benefits that you might get out of it. Try it for 3 months. Tell me at the end of 3 months, besides from all the things that I think is going to do for you, tell me what else you notice that all the benefits that you are deriving from it.
Fantastic. Well, they want to know what patches you're using.
Well, I regularly use the X39, the X49. I use the Aeon patch. I use the carnosine patch. I use the glutathione either every day or every other day, depending on what I'm doing. And that's basically it.
Fantastic.